When facing a cancer diagnosis, the unknown can be daunting. At the Center for Cancer Care at Griffin Hospital, we combine science with sensitivity and a compassionate healing environment close to home. While we navigate patients through their cancer journey every day, we realize no two situations are alike. Nothing is ordinary, standard, or prescriptive. From the moment of a diagnosis, a collaborative team joins forces to walk side by side with you through each and every challenge we encounter.
The experience here with the staff at Griffin has been wonderful. I didn't know anything about prostate cancer, the process, and they were very educational. They took the time to explain if I had any question whatsoever.
They're absolutely delightful to be with. They're comforting.
Everybody's so good, and they all know their jobs so well. And there wasn't a single thing that made me tense about coming here every day.
So let me show you what your experience will look like. In determining whether surgery, chemotherapy, radiation therapy, or any of these in combination will be your most effective course of treatment, your physician considers your general health, your medical history, as well as the type, size, and location of your cancer. When preparing for your first consultation, consider writing down a list of questions or concerns you would like to discuss with your doctor, and think about having a family member or friend come with you as an extra set of ears. When you come into the Cancer Center at Griffin, you will be greeted by an experienced patient service representative who is the first of your team members. Please bring your current insurance card and a photo ID so your insurance information can be gathered, and we could assist you with filling out patient registration forms. If you had any imaging studies or lab work done outside of Griffin Health System, please bring those records. It is also helpful if you prepare a list of current medications, including the dosage and how often you take them. Depending on the recommendation of the referring physician, you may have a consultation with both radiation and medical oncologists. That doesn't necessarily mean you will need both radiation and chemotherapy. We are just exploring treatment options and getting to know you as a patient. If it is determined that you will be going through radiation therapy, your consultation appointment will take about 2 hours and include a physical exam, discussing your overall health and assessing any cancer-related symptoms you may be experiencing. We will also spend time reviewing your medications, past medical history, surgeries, and recent diagnostic tests that have been done. We will discuss treatment options, expected outcomes, and any treatment-associated side effects. Basically, we will make a game plan and how we plan to team up to manage your medical playbook. Preparations for your treatment will begin with scheduling of a painless CT simulation. Your care team will let you know if there are any special steps you need to take prior to having the scan. The simulation sim appointment serves as a key planning tool for establishing your treatment position and creating custom molds to help you hold in the same position for each of your daily treatments. Images will outline and map the exact area being targeted and visualize all the surrounding anatomy. Our goal is to establish both the best position for treatments and keep you as comfortable as possible. This appointment takes about an hour. And after your simulation takes place, treatments normally begin within 1 to 2 weeks because the next steps involve the development of a precise and individualized treatment plan based upon the type, size, and location of your cancer. In radiation oncology, a dosimetrist is like a treatment planning engineer, with a medical physicist work behind the scenes using special software that calculates the beam angles and radiation dose needed for the most effective treatment.
The idea is the radiation is going to go where the tumor was and directed directly on that, and nothing else was affected but the area where the tumor was itself.
There are many, many levels of quality checkpoints to make sure it is right. This is very precise work and designed to preserve your good healthy cells while killing the bad cancer cells. Your skin will be marked with small dots of permanent ink called tattoos to ensure that the precise area is targeted and treated each time. Digital photos documenting both your treatment position and your tattoos will be stored in your electronic medical record. The treatment plan they create is reviewed in collaboration with your radiation oncologist and the radiation therapists, who will be there with you through every treatment. Once your radiation oncologist has determined how many treatments will be needed for your course of radiation therapy, they will be scheduled. A full course may take several weeks, while other treatments may take only a few days and given Monday through Friday. Typically, your treatments are 15 minutes and scheduled for the same time each day, with consideration to your time preference. Your first day of treatment tends to be the longest, around 30 minutes.
I travel a lot, and I know it's important, but I have to fit it in as well. And he fit me in for the markup. I started treatment 1 week later. I went 45 days. There was one snow day, so we had to make that up. I was traveling in May, and we were able to fit it all in the day before I left for my business trip.
Your radiation therapist will greet you in the waiting room and escort you to the treatment room. They will explain the process and be able to monitor you at all times through the use of closed-circuit TV monitors and an intercom system. The treatment is completely painless. Radiation cannot be seen or felt while it is being given. After your daily treatments, you are free to continue all normal activities.
When you go in for your radiation treatments, first of all, there's no reason at all to be stressed. It's such a calm environment. There's music going, there's people talking to you and joking with you. It's just relaxing. And the time you're laying there, it goes by so quick.
During the course of your treatment, once a week, you will see your doctor and nurse, which will take an additional 30 minutes. At this appointment, you should expect to have your nurse and your doctor assess any treatment-related symptoms and help manage them as appropriate. This is a great opportunity to ask any new or continued questions or concerns. Family members are always welcome to join. When your course of treatment is completed, your radiation oncologist will need to see you for follow-up visits to evaluate the effectiveness of your radiation therapy and monitor how you are feeling. This may include lab work or imaging. Medical oncology and the delivery of chemotherapy drugs is sometimes the only treatment a patient requires, or is sometimes used in addition to radiation therapy. Our medical oncologists tailor the type and the delivery of chemotherapy to the patient's particular situation to achieve the greatest outcome. Since chemotherapy is delivered over several hours, we have created a warm, relaxing, Zen-like environment where you could visit with a friend, read, or watch TV and rest comfortably. Similar to the process for radiation oncology check-in, on your first day, you will check in at the front desk, sign a HIPAA privacy form. Your personal information will be confirmed and you will receive a bracelet. After a brief time in our waiting room, a technician will call you into the lab and have blood drawn. When your lab draw is complete, another team member will take your blood pressure, pulse, and make sure that everything is in place in the computer: height, weight, pain scale, and fall risk. You will then see your medical oncologist to review information, have a physical exam, and set up any additional testing necessary to determine the diagnosis and treatment options. After that visit, you will check out at the front desk to get a return visit appointment to review test findings and map out a plan together. If you are scheduled to receive chemotherapy, you will meet with your care team each time you come in before going in for your treatment. Unlike radiation that tends to take place 5 days a week, chemotherapy is less frequent depending on your care plan. When treatment is completed, the patient attends follow-up clinics for up to 5 years. These are held to assist the patient in managing any post-treatment side effects and to monitor the disease regression or progression. Initially, the patient attends the radiotherapy center. Annual follow-ups may then be conducted at a hospital closer to the patient. In addition to your primary treatment approach, your doctor may recommend additional therapies or services to support your treatments or to help you cope with side effects. These may include nutritional consultation, patient support groups, massage, neuropathy, homeopathic prescriptions, yoga, or relaxation therapy, to name a few. Whether you are in medical or radiation oncology or both, our physicians work closely with a team of cancer-trained oncology nurses, physician assistants, and nurse practitioners who will be important partners for you throughout your treatment and beyond. At Griffin, there's more to cancer care than treatments, medication, and therapies. As a comprehensive cancer center, we offer support and education programs that help you navigate the emotional and physical effect of your situation and prepare you for a healthier life after treatment.
The treatment is wonderful, the staff is great, and it's just a great place to come, and you know that you're getting the best of everything.
I do miss it. And that's crazy. I know it is. It sounds crazy because of what I went through and for what reason, but I just felt at home here. Really did.
The people here are wonderful. They're absolutely, everybody cares. They're my friends.